The idea of forcing someone with a drug addiction into rehab, experts say, is legally and ethically complex. But it's an idea Alberta's United Conservative Party's Minister of Public Safety says is being considered as the addiction crisis continues.
To make sure that we are compassionate, and I would say that it's not compassionate to allow that person to continue to overdose 5 to 10 times a day.
The Globe and Mail reporting Tuesday, Alberta is actively exploring creating a framework for what they call a Compassionate Care Act, involuntary treatment if someone with an addiction is charged with a non-violent crime, or if their family or police can prove to an independent panel it's necessary, pointing to programs in some U.S. states or countries like Portugal. But this type of policy would likely end up in court because of the Charter of Rights and Freedoms.
The real argument would be whether government can justify that infringement on individual rights. And that would be a real uphill battle for them, given that I haven't seen compelling evidence for this kind of policy. And I think that it would be hard for them to demonstrate that they didn't have alternative policies available to them that would impair individual rights.
Right now, the Mental Health Act already allows for someone to be committed against their will when dealing with a crisis, including drug addictions, but only under extreme criteria, if they pose an immediate risk to themselves or others. But they have the right to refuse treatment if they have the capacity to understand the risks.
It may drive people to not seek treatment if they fear that seeking help might then subject them to involuntary treatment that they didn't want.
The Minister of Mental Health and Addictions office maintaining no decision has been made, but they will continue to build out a full continuum of care, including prevention, intervention, treatment, and recovery. And while the NDP government in British Columbia has said they are looking into forced treatment, the Alberta NDP in a statement to City News saying this will not solve the drug poisoning crisis. To help someone suffering from addictions, you need to meet them where they are, while committing to investing in evidence-based mental health. In Edmonton, Carly Robinson, City News.